Now Katie's really got her work cut out here. You can see this is a deep, deep plug and it's surrounded by skin. This is not going to be an easy one for her to remove. It's kind of soft in the middle, hard around the edges, so a real tough old plug. So this is Katie's patient, you can see here, guys, and what we've got is this really, really solid plug in here. It looks dry as a bone, really, really kind of dried out. Now, normally inside the ear canal, what we produce is a little bit of oil. So when the wax gets to this outer section of the ear canal, it's become a little bit softer. It softens it just before it gets removed, if you like, and the body will expel it itself in most cases. But sometimes things like this happen where you get these bigger plugs that sit inside the canal and they just harden up. Now, the first thing you saw her remove there was that sort of grey material just off onto the right-hand side there, and that's actually a layer of dead skin. So what she's got here, which makes this a tough old removal for her, bless her, is you've got this really kind of thick plug surrounded, you can see it there, by this layer of dead skin which is wrapping it around the outside edge. Now, the way that skin normally forms inside the ear canal is totally different to the skin everywhere else on your body. So everywhere else on your body, the surface layer of skin comes off as a really dry kind of fine dust, and then the next layer of skin is there ready to replace it. Now in the ear canal, it does something very different. If you imagine my palm is the eardrum, right in the center of the eardrum is where the newest formed skin cells are, and they push their neighbors outwards, so the skin migrates across the eardrum, and then that forms the ear canal wall skin. Now I want you to picture it growing like a conveyor belt, going from the deeper section to the outermost section of the ear, where it gets softened, as we said, with a little bit of oil, and it falls out with wax. So wax, or cerumen as it's called, is basically a mixture of old dead skin, oil, dirt, debris, all the stuff you don't really want inside the ear canal. So wax has got a really important job. It picks all this up, combines it together, and normally falls out. Now what's happened with Katie here is that it's stayed in situ, and then you've got this layer of skin which hasn't quite managed to migrate out and is now hardened around the outside, like a little parcel, almost like wrapping, if you like, for this plug. And then the plug in the center then can't absorb any more oil, and it's not softening. So what it's doing is dehydrating, it's hardening over time. So now we've got this really hard plug with this layer, this wrapping layer of skin around the outside edge, and all of those things are going to be holding on to one another. So the plug is going to be holding on to the skin, the dead skin is going to be holding on to the fresher skin underneath, so nothing wants to let go in here, and that's what makes this removal difficult. But Katie's really, really good at these types of removals. You'll see this layer of dead skin here just around the top side. So what she's doing here is using the suction tube to draw the edge of this wax away from the canal wall. So she's really trying to separate wax from canal wall, which is going to allow us then to pull this plug out. But you can see it's really holding. It doesn't want to let go of that canal wall particularly well. And she's done a really good job of just working around the plug, almost like a clock face. So you want to really work around from 12 o'clock all the way around, right the way back to 12 o'clock again, and just pulling away. And that's exactly what she's doing here. You can see the center of that wax. She's taking a good look at it. And this is really important when you're doing these wax removals. You can get very kind of engrossed in what you're doing, and sometimes you just need to take a little step back away from it and appreciate it as a whole and say, okay, well, you know, maybe I should move to this area, or, you know, we'll try out moving this side. It's just kind of gently probing the outside edge of that wax to see what works. But she's also going to be very, very mindful of the canal walls, because the canal walls in these types of ear canals, well, in all ear canals, are super sensitive. So, and skin is very, very thin. So if you scrape it, you can end up with a bleed, which isn't, you know, it's not the end of the world. It does happen sometimes in wax removals, you know, and usually the bleed stops within a couple of seconds and you can carry on. But it would feel a bit uncomfortable. You'd have almost like a sharp, scratchy sensation inside the ear if that happens. And you don't really want that for your patient. You want your patient to, you know, have a really good experience. Now you can see now that it almost looks like the texture of the wax has changed. So what's changed between that last shot and this one? Well, Katie's used a little bit of irrigation. So sometimes we'll use irrigation, or syringing as it's more commonly known, to break down wax, to soften it a little bit, especially if you've got a really hard plug like you had there. Using a bit of irrigation just tends to soften the surface and can make things just a little bit more easy to get out. Right, she's pulling, you can see that layer of dead skin really clearly there as she's pulling down. And this would have been running the whole length of that wax plug. So not just on that outside edge where you can see her working. Look how far back that piece of skin goes. So she's going to start now. Let's start pulling this section. She's looking for any gaps. We want to see a little bit of movement to this plug. But look how thick that underlayer of skin is. It's really holding that in place at the minute. Let's see if we can just work this left hand. Oh, nearly. There you go. You can see that little bit of movement. See how that front end has just started to lift a little bit? So that section is detached. Great. So now we've got the sort of the main kind of bulk of the plug. If we can pull across from this right to this left as she's doing here, we're going to free up that bottom section there. See that little bit of mobility? She's got the plug now. She's done really, really well there. And let's have a look at this. Let's go back in now. Let's grab the edges. Absolutely brilliant. She's done a fantastic job of getting that out. They're not easy removals to do by any stretch of the imagination. Really difficult old removals to do. But look at that eardrum now. It looks a lot better. That patient's going to be hearing so much better on this one. Now, I think this is actually Taylor's patient. I don't think there was a ruler shot on that one. So we moved on to Taylor, who's the other audiologist who works here. Very different kind of setup in this one. We've got, the same kind of sticky wax at the entrance here. It's just started to harden up a little bit. Little layer of dry skin. You could see as he pulled that, you could see it stretching out of the ear canal there. And that is certainly a flap of skin here as well. So we've still got that underlayer of dry skin. But the wax plug on top of it, nowhere near as large as Katie's was. So, we've got a little bit more room for maneuver in here. So it's going to be a little bit easier to get out. But it goes back a fair way looking at that. It does look like it's almost covering part of the eardrum there. So let's see if we can lift this front section. Here we go. Guys, if you are a regular viewer of the channel, you will know that it's normally me and Taylor are voicing these videos up. Now, you've had Taylor for the last 2 weeks. And today, unfortunately, we're doing some staff training, and it's the only time I can get in today to do the voiceover. And poor old Taylor's done the last 2 weeks, so I did feel a bit sorry for him instead I do the voiceovers this time. I'm hoping that me and him are going to get back together. Probably it won't be for this week's videos because I think you're going to have me all week, but we will be back together really soon. Okay, so next week we should be back to normal again. Now you can see he's managed to get this section away here. Let's pull that all the way up. Look at that. Nice long plug of wax, that one, and eardrum looking really healthy. You can see that eardrum beyond there straight away. So just a bit of tidying up here at the entrance to the canal. There we go. He's using a fine end here. There we go. Out that comes. Nice little chunk of wax there, and a good looking eardrum there, looking really healthy deeper in. He's just taking, there's a little lip there on the one side. He's just taking these little edge pieces away. Not going to make any difference whatsoever as far as the hearing's concerned, but obviously, sometimes it's easier just to get these little bits away. And it looks like there's a little bit of a deeper section down there. Wow! Look at that. So we've got this, almost like this little dip inside the ear canal. Look how much he just pulled out. At first glance, you wouldn't have seen that. So now he's going to angle the endoscope up so you can take a good look. But that's quite a prominent dip there. Now, sometimes you can get something called canal remodelling, which is where, especially if you get lots of bits of dry skin around the outside edge of the ear canal there, or at any portion of the ear canal, I suppose you could say, you get this thing called ear canal remodelling, which is where the pressure that's put on the canal by the blockage that's in there, if it's in there for a long period of time, can actually reduce blood supply to that particular portion of the ear canal. What you end up with then is it forms these little divots, these little dips inside the ear canal, which is more likely to trap things like dead skin, wax, those kind of things. Remember we talked about that conveyor belt of skin that moves out. If you get into that, you've got to kind of drop into the dip and then come back out the other side. So sometimes it causes it to dry out a little bit more. But it's coming away really, really nicely on this one. Layer of dry skin at the bottom of the canal there, but he's doing a sterling job, Taylor, on this one. Guys, don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe for me. If you thoroughly enjoy the videos, you can also consider becoming members of the channel, and that way then you get to see 2 more days worth of videos every single week. So we post those on a Tuesday and a Thursday. And don't forget to smash that like button for me as well, guys, if you don't mind. And if you're feeling really brave, you can always share for me. That'd be amazing. So he's got rid of the dry skin at the base of the canal. You see a little bit of a pimple there on that white pimple on the right hand side is what I meant to say. Nothing to worry about on that one. That you get these they're almost like little tiny cysts. You get them quite a bit inside ear canals. They're nothing to worry about. They're completely innocuous. You really don't need to take them away or bother with them too much. Oh, that's a nice plug. You can see the whole thing just starting to come forward. Sorry, I lost my train of thought there. You can see that whole thing starting to come forwards here. Look at that. And again, just going in this is the section I could see just moving forwards just a second ago. Can we get a grip here and will it stay intact as a whole plug? Yes, it will. Look at that. That is a sizable chunk of wax there. Little tiny bit of dry skin to the right hand side and a little tiny bit of wax just on the brow there. You can see that little hill. There we go. I think Teddy does go in a second, have a good look at that little pimple we've got there, a little cyst. And it's coming away really well. That's the last of it. Looking good. Oh, can you get this last little, a little bit of dry skin here. This is more just a bit of tidying up, taking these little edge pieces away. Let's just take that bit away as well. Absolutely brilliant. Look at that, coming away so well. Nice, and the eardrum looking really healthy there, really healthy. So this is that little cyst we were talking about here. Like I said, nothing to worry about. They're quite common in people's ear canals. It really doesn't affect the hearing or the ears at all. 4.5 centimeters, 1 3/4 inches. Guys, if you do enjoy the videos, I'm going to put another one up here, which I think you're going to really enjoy. So make sure you check that one out as well for me. But as always, guys, in the meantime, take care of yourselves, take care of your ears, and really importantly, take care of one another. And I'll see you for the next video. Bye, everybody.